Well, as the sun sets here in South Carolina at our home, the sun is also setting on a perfect relationship, it seemed, between a Medicare Advantage plan and its hospital network. They are no more.
Now many patients are left searching for a new plan. People are upset because they're not sure why this is happening.
After Peace Health announced the news, Trillium patients have been flooding Medicare brokers like Scott Sims, and they have questions.
What do we do next? How do we keep our doctors and you know, I've been with maybe this insurance carrier for many years and they've taken care of me, and now all of a sudden I have to switch.
This story comes out of Springfield, Oregon. Peace Health is not renewing its contract now with HealthNet and Trillium Medicare Advantage plans for 2020. What's unusual about this particular situation is that usually these things happen during the year and people are just left scrambling to go get a different Medicare Advantage plan if it's big enough of an impact where CMS will give them a special election period. See, typically on a Medicare Advantage plan, if you lose your doctor or you lose a hospital, they think it's no big deal. You can merely go find a different doctor and go to a different hospital. Those contracts are not typically on a calendar year basis like this one happens to be, which is good for people because now we're in the middle of an annual election period as I record this, and these folks can merely just go sign up for a different plan, but it may be completely different doctors and hospitals. The story reads, Peace Health is not renewing its contract with HealthNet and Trillium Medicare Advantage plans for 2020. Now many patients, this is an NBC story, now many patients are left searching for a new plan. The hospital says, oh, we remain in network for HealthNet and Trillium Medicare Advantage plans throughout 2019, as if that's a consolation. Going forward, Peace Health patients in Lane County can select another insurer. I've had to call my friends and brokers, and then it just goes on and on. Earlier this week, a federal judge ordered HealthNet and Trillium to notify the public that Peace Health is not renewing their contract for Medicare Advantage plans in response to legal action brought by Peace Health. Meanwhile, Trillium has filed a lawsuit of their own. And where does that leave the senior who was on this plan thinking that this is going to be the one they're going to ride, for the rest of their Medicare world?
You trust that what you were in was good for you, but, things change.
Paul Brothers of Eugene has been with HealthNet now for 6 years. He chose them for zero copay for his medications.
You want to conserve as much money as you already have, and so that was just a really good option for me, and I didn't anticipate many major medical problems when I retired.
Peace Health spokesperson Jeremy Rush said in a written statement that it's important to know that nothing changes today. Peace Health remains in network with HealthNet and Trillium Medicare Advantage plans throughout 2019.
It's important to remember, there's my dog out there. We have 3 little rescue dogs. It's important to remember that Medicare Advantage contracts are annual contracts. It is a 1-year contract between you and the health plan. It is not a permanent coverage of insurance where you think that all the benefits that you enjoy when you first sign up are going to be there for the rest of your time on Medicare. Could not be further from the truth. If you're watching this during the annual election period, I highly encourage you to look at your annual notice of change, see what's changing on your plan, see what's changing with the copays, the network. Make sure your doctor has a contract with the plan and intends on staying with the plan for the whole entire year. It's a little tip from a friend of mine named Sylvia who said, maybe you should contact your provider and find out what time of the year their contract renews with that Medicare Advantage plan. And that's a very good tip. Find out if the doctor has the intention of staying with that plan. These negotiations happen every single year. And again, these folks now are lucky because this happened during the annual election period, so they can find a different plan. Just something you need to know about. It's just part of the world of Medicare when you're looking at a Medicare Advantage plan. Just to provide balance and context on a Medicare supplement plan, those benefits never do change. What you sign up for when you sign up for a Plan F or a Plan G or a Plan N or Plan J or Plan L, whatever it was you signed up for, you can keep that benefit, even if they don't even sell that plan anymore in the future. My name is Chris Westfall. I'm a Medicare insurance broker. If this or anything else needs clarification, please comment below, or even better, if we can help you with your insurance from coast to coast, contact me at the phone number listed below. That's 800-729-9590. Would be happy to help you. Alrighty then. Have a great day.
I've had a couple of my friends call me, and I've talked with them, and they basically have done the same thing. They've talked to their insurance agent, and they've had to make a decision.
A crucial time for patients as they try to find new coverage. Reporting in Springfield, I'm Stephanie Roth.